welcome to my YouTube channel. My name is Funke Bangba, and in this YouTube channel, I'm going to be talking especially to newly qualified nurses, returnees, maybe just nurses that are trying to gain insight working within the NHS. So it's been nearly 7 years now working within the NHS. And I thought, okay, it's time for me to share some of my experiences, some of my mistakes, some of my, things that I got to know late that I wish I knew early enough working within the NHS. And so stay tuned. If this is something that is really of interest to you, then I want you to subscribe, like, share, and stay connected for more series on how to build a career as a nurse within the NHS. So today I'm going to talk about what every nurse must know when starting within the NHS. If you're newly qualified, employed in the NHS, and you feel confused, overwhelmed, or like you're just trying to survive each shift, then this video is for you. Nobody really explains how NHS work. They just expect you to show up for the job and do your shift and then figure it out yourself. But here's the truth: the nurses who thrive in the NHS are not just clinically skilled; they are integrated within the system. They understand how the system works. They find out what really makes the system work for them to their advantage, and they utilize it. Okay, so today I'm going to break down what NHS really is, how it structures, and where you fit in the nurse. Hello, welcome back to my channel. I am Funke. I'm a nurse, I'm a mentor, I'm an educator. I'm very passionate about growth and career progression, especially within the nursing healthcare professional. I have moved from just being a bedside nurse to becoming a practice educator in the NHS. And I'm still building my portfolio, trying to find and seek opportunities within the NHS, especially whereby for the NHS 10-year plan is for them to move from analog to digital. Hence why I am currently also a master's student in University of Lancashire studying digital health. Right? So this is my first video. So please like, share, and subscribe. What do you need to know when you first employed within the NHS? So I'm going to talk about what NHS really is. So NHS stands for what? National Health Service, right? And it is a public funded healthcare system, meaning it is largely funded through taxes. Its purpose is simply to provide healthcare based on clinical needs, not just ability to pay. Do you see? However, what many nurses don't realize that NHS is not just one single organization, it is a network of organizations. So when you say I work for the NHS, you're actually working for an NHS trust that is within the NHS system. And that is why your experience would differ. Your engagement with equipment or technology softwares that each NHS use will also differ. Same as their policies. And I'll be sharing more light on why it is important for you to have a good understanding of the trust that you work in. NHS England set national directions and priorities. Care is delivered locally through the NHS Trust, and services include hospitals, community care, mental health, GPs, and many more. Right? So now, understanding NHS Trust and where you work, it is very important. Before now, when I was still a bedside nurse, I know how it can be very demanding, working within the hospital, the ward. And I can categorically say that I've never engaged in any policies or reading any policies before. But, moving into the education role, I realized that there is quite a lot of importance and, essence of why we must engage with policies, which I'm going to be sharing even more light in the course of, engaging with my video. So your employer is not the NHS, it is a trust. Yeah. And this explains that active trusts, in brackets hospitals, the tertiary hospitals where you have your A&Es and all the major words. We also have the mental health trust that deals with mental health issues. We have communities that, link up with the social and healthcare sector, which I'm going to even talk more about that as well. And we have specialty trusts, trusts that basically would focus on pediatrics or children, or trusts that would basically focus on, gynae, anything around, birth. So we have hospitals like that, which also are integrated, across the other NHS, hospitals. Yeah. And each trust, we know that they have their policies, they have their culture, they have their values, they have their leadership, cadre, and they have their priorities, right? Despite being called NHS, it is still differ in terms of what is of utmost important to them, what they value the most, and what their policies look like. That is why, regardless of whether you from one NHS into another NHS, you must engage with what is obtainable in that new NHS, and let go of the ones you've learned from the previous NHS trust. Okay, Now let's talk about integrated care system. Integrated care system, which is also known as ICS, explain the fact that NHS works alongside, like I said, integrate with local councils and partner with working together with even private organizations, right? So their focus mainly is on prevention, population health, and community care, right? So why does this really matter as a nurse? I want you to know that one of the major things that I've come to understand, especially within the NHS 10 years plan currently that we have now, is that NHS is moving towards desaturating the health and the tertiary hospitals, which is the acute hospitals like the A&Es, where we are having longer waiting time, and dispatching those patients into the community, to their localities, so that they can be seen faster and quicker. And how are they trying to do that? They're trying to equip the community. So now, as a nurse, if you really enjoy community nursing, that is an opportunity there for you that you want to start putting your eyes on, because you're going to gain a lot of opportunities from that space, right? So care is becoming more community based. New roles are emerging, definitely, and career opportunities are expanding beyond bedside nursing. Remember, one of the key things for NHS 10 years plan is that they want to move from analog to digital. So we're going to be seeing a lot of digital enrolled opportunities, digital empowered roles, that if you have your eyes on the digital skills that is required within the NHS, there's high chances that you are going to get a role from just being a bedside nurse to becoming, a digital nurse, right? So keep your eyes on that. That's why I'm doing masters in digital health. I'm one step ahead of NHS. So that's what you want to do. So where nurses fit in the NHS system? Let me say this clearly. Nurses are the backbone of the NHS. You have the backbone. If you look at the numbers of the employees within the NHS, you would realize that nurses is the largest number. Yes, and that is why the art, the art of the NHS is the nurses. So you must carry yourself with that understanding. It hurts me so bad when I see nurses trying to live, a mediocre and average life, feeling that they're just there as another, assistant to the doctors. You are nuts. And in this modern age, can I tell you that is a lot of role that nurses are going to be more or less an authoritarian in that space. Yeah, where you're going to be like the one consulting, the one looking after a patient from the start to the end. Those are some of the emerging roles that will be coming into the community, because the NHS, the government, they're trying to empower, the community, the GPs, the neighborhood health center. That's part of one of the things that they are building now, in such a way that they would have, equipped hands to manage even those cases that would have come to A&E, so that A&E is not overwhelmed, because A&E currently is overwhelmed with a large number of people waiting for long hours on the chair, on the couch, in the corridor, and that is not healthy. That is not what we want, right? So keep your eyes on community. A lot of empowered, equipped roles will be coming in place. So what some of the things you want to start thinking is, what skills do I need to start embarking on? What competencies do I need to work in? What trainings do I need to engage and enroll in, so that I would be at the cutting edge when these opportunities begin to arise, right? So nurses are involved in direct care. We know that, yeah? Leadership, education, research, digital health, just like I am. Nurses influence safety outcomes and patient experiences. These are some of the things that we do, not just as a nurse who gives medication, right? But more around leadership, more around, patient outcome, patient safety, right? Research, okay? So, but here is the part that many nurses missed. If you don't understand the system, you can feel powerless inside of it. Do you agree to that? I remember when I first came into the NHS, and I didn't realize that, NHS, what's it called again? Annual leave, run from April to March. And I think I came in February. And for me, it means, coming in February, you still have a few days that you can, few annual leaves that you can still get, because you started February, that's the previous tax year, before April. But I didn't know this. And nobody told me. So I lost the annual leave then. And I only get to know after, we've gone into the new year for a fresh annual leaves to be dispatched across the different banks. So it's very important for you to really engage with the trust intranets, the trust policies, the informations that is very peculiar to the hospitals that you're working in early enough, right? Don't be too carried away with the heavy workload, right? You want to know what is working in the system so that you're not left out, okay? So if you don't understand the system, you can feel powerless inside of it. Like I said, when you understand how NHS work, you advocate better, you document smarter, you escalate confidently, you even grow intentionally, right? You grow from just being a band 5 to a band 8. if that's what you want, right? Because you have good understanding of what it entails in the trust you're working for. So finally, here is your action plan, right? I want you to take time to learn about your trust. For those of you that have just recently been recruited into the trust, I want you to find time to read about policies. Now, I will give you some of the policies I would really love you to engage with. Number one, your leave policies. The leave policies. What is obtainable for annual leave, for maternity leave? When can I have what? For special emergency leave, we all have that, right? So I also want you to look at flexi working hours. How can I enjoy working better without being overwhelmed, that can fit into my childcare, especially for we that comes in from the overseas. We struggle a lot with childcare. So some of the things we want to look at is what are the flexi working hours opportunity that is in my trust, and you find that in their policies, right? Another thing I really want you to engage in terms of policies, appraisals. How do I progress? What are the some of the things I must do to progress in my career, in my field, in the area that I want to specialize in, right? I also want you to understand the escalation process. How do you escalate? Look out for people that are called the freedom to speak if you have one in your trust. How do I escalate concerns? How do I escalate things that are unhealthy within my work environment or my trust? You want to go read about that. Also, there are things like opportunity for discounted stuff that people sell within the NHS. In my trust, we call it the cafe network. So if you go there, you see people bringing things up to sell at a cheaper rate, and you can always get it within the trust. So look out for things like that, so that you can it helps you to manage your finances, right? You don't have to, especially for those that are just moving into the country and you're still trying to find your bearings. There's so much to buy. You want to get a house. You're going to start paying bills and the rest of them, or you're even trying to bring your family over. These are things that can help you to minimize costs and still get it in a very good shape, at an affordable price, right? So you want to look at that. You want to go into the internet, look at all the things that are found on your trust internet and how you can benefit from it. Which one of them do you want to know more about, right? And I also want you to read policies within the role, within your JD, within your job description. Read policies around that, right? Policies that talks about medication, safe medication administrations, IV therapy, policies that talks about pressure sores, pressure ulcers escalation, food and hygiene, the things you are, that is within your job description, within your JD that you do on a day-to-day activities. You want to learn more about it. And I also want you to find out who are those that that have been assigned to you as your preceptor, as your mentor, right? Within the first year of being in the NHS, you would have a preceptor and a preceptee, right? So you want to ask questions. You want to ask them, how can I learn? How can you help me to be better, to do better? Learn things around prioritization, learn things about safe administration of medications, learn things about control drugs, recorded drugs, learn things about, medications that are time critical bound, right? So that you can be safe in nursing. So that is a start, and I hope this has been very enlightening for you. So stay tuned and subscribe, because I'm going to be sharing more light on how you can grow step by step within the NHS. Thank you very much. I remain Funke. I remember, and I will see you on my next episode. Bye for now.